Okay, hi, my name is Riley Patton. I'm here to talk about typhoid fever for my microbiology. So, the reason I picked this was mainly because I was a big reader growing up, and I always knew that Anne Frank died of typhus. I thought that typhus and typhoid were the same exact thing, but honestly, they are not. They have pretty similar symptoms, but the causative agent is completely different. Typhus is from rodents and fleas and stuff like that. Typhoid is mainly based on sanitation. So we're going to get into that. So modern sanitation should be considered as a basic human right. In America and non developing countries that have pretty much established waste systems and ways to clean their water and just not have human excrement just everywhere. We don't really see this, but living in a country without clean water, waste management, or without ways of cleaning yourself can cause many diseases, of which affect many countries each year. So that's like developing countries like India and um, many other ones that are very, very populated, and that can cause that. So typhoid fever is an illness that affects the small intestines. It is also known as enteric fever, which enteric means intestines. This causes fever, stomach pain, and other symptoms that can last around 7 to 10 days. And it has this very noticeable macular rash around it, which is flat and red in bumps. Usually they don't become papular, but that is what the rash looks like. Typhoid fever is caused by the bacteria Salmonella typhi. It is classified as a gram-negative bacterium that enters through contaminated food and water. And I also thought, I was like, Salmonella? Does that have any correlation? And it does, but it's a different type of Salmonella than regular Salmonella poisoning. And yeah. So, symptoms can include high fever, constipation, fatigue, and nausea, and that macular rash. And the high fever is not just like 99, that's low grade. This is high fever. This is around 104 to maybe 103. Like it gets bad with that. The process of typhoid fever. So I've kind of laid it out here, and it goes down by like the green to the yellow to the orange to the red, and then to the big red letters. And that just it goes by how bad it can get. So first, it enters through your GI tract, usually from just contamination to food, and then in the ileum, it attaches to the macrophages. Your symptoms stay dormant for about 3 weeks. So you just will not be symptomatic, and then all of a sudden you'll get this bacterial infection. You'll start having symptoms. You'll start having the fever. You'll start having the rash, and eventually, if you just don't get it taken care of, it can lead to a bone infection, and then from that, it can lead to your gallbladder swelling, and like lastly, it can cause internal bleeding and abdominal distension, which is pretty bad. So, where is it most popular? So, in the US, we rarely see cases of it, but in these developing countries, it can be very prominent, and especially in like the northeastern countries, it can be pretty bad. So, and like you can see, like um, it's mostly underdeveloped countries that are causing that. So, the cases over time, I could not find like from whenever it was really predominant here to now. This is basically from 2011 to 2020, and you can see that the cases, they kind of just fluctuate up and down. um, but on the side, usually in graphs like this, it's like in the millions. No, that's quite literally 10 people in the United States that have had it. So like I said, it's not a very big deal here, but in other countries it is. So, the history of typhoid fever, it is a widespread plague from typhoid fever in Athens. Actually, I think it was Alexander the Great. He was an ancient Greek king. He died from that, actually. It is believed to have killed around 6,000 settlers in Jamestown. That was from 1607 to 1624. And if you think about it, it makes sense. I mean, they didn't have modern sanitation. They were using the bathroom over there, and then it would wash down into the fields and get contaminated with their food. So, I mean, that makes sense. And then 8,000 um, died during the Civil War due to it. I mean, again, you're living in close quarters and there's not proper sanitation. So, I mean, that can cause that. And then we get to Mary Mallon, which is named Typhoid Mary. So, Mary was the first person in the US to be a carrier of typhoid, but yet show no symptoms. So, she worked as a cook and was known to have had infected around 51 people. 3 of the cases proved to be fatal. So she was like a cook and she would usually work for rich people and would just basically be a maid. And then she would work somewhere, everybody would get sick. And then after that, she would just pack up and leave. She kind of knew what she was doing, but she didn't believe it. She just kind of thought it was just like her luck. So Mary was forced into isolation 2 times, and in the second isolation, she died. Mary was known to not wash her hands when she would prepare food for the wealthy families, and she would quite literally get the family infected, change her name, and move to a different family and get them infected. It was just a one big cycle. And she was also like, whenever she was forcibly isolated, the first time it was just for a while, and then the second time it was like, okay, you've infected all these people. Some were actually children that died, and they're like, you can't be in society anymore. So they basically put her in there into isolation, and that was it for her. And scientists find it really hard to understand like how you could be asymptomatic and still pass that on. So, but that was like back in the time where they didn't really understand what made you that sick. So in 2013, scientists at Stanford found that the salmonella bacteria had the ability to hide in the macrophages and attack their metabolism. So it caused you to just completely be asymptomatic and still carry that with it. So the first type of treatment that they tried to develop was in 1896. It was a vaccine and it was helpful to soldiers who were high risk, though it never became widespread enough to be available to the general public. So it only affected like the soldiers and the military. It didn't affect anybody else. So people were still getting it. And in the early 1900s, the disease was extremely dangerous. The mortality rate was 10%. So if you think 1 out of 10 people, one was going to get it, or no, 1 out of 10 people that got it, one of them was going to die. So there was no cure available at that time. So you basically, if you got it, you kind of were just hoping and praying that nothing would come of it and you would fight it off. So nowadays we do have testing for it. You can get a CBC, which, I mean, a CBC, if you're high number of white blood cells, that means you have an infection. So that would be a acceptable diagnosis, and a blood culture. Um, it grows, and then it would show the Salmonella typhi in the bacteria. The ELISA test, I know that we talked about that in class. It looks for antibodies of the Salmonella typhi bacteria, and a platelet count. That could be, if you get a platelet count done, it could show that it be low, and then you'd know that there'd be something causing that, so they would look into it further. Treatment. So treatment is mostly antibiotics, multiple depending on the variant of typhoid. This can include ciprofloxacin, ceftriaxone, azithromycin, and carbapentins. And the antibiotics, they weren't invented until 1928. So, I mean, that goes to show, like, they wouldn't have known, that would have cured it. With severe cases, if you wait very, very long, a steroid may be prescribed. Dexamethasone could be to help bring that down. So the antibiotic, whenever it encounters Salmonella typhi, it depending on what is prescribed, mostly is the cillins. So penicillins, they break down that cell wall, and then others like tetracycline or dioxycycline, they prevent the ability for the bacteria to reproduce. So side effects of treatment. So if you get a vaccine from it, you have the general types of uh, side effects from a vaccine. So like pain from the shot, redness, swelling at the site, injection. You could get a fever if you're starting to kind of reject that, a headache, just general discomfort. With the inactivated typhoid vaccine. Now, if you get the activated typhoid vaccine, you could get the fever, the headache, the abdominal pain, the diarrhea, the nausea, and vomiting. And that's basically just all the symptoms of typhoid. They're just not going to be that 104 fever. They're not going to be that macular rash. It's not going to be as bad. It's just going to be just a little bit of it. So, prevention. So, a typhoid vaccine is not something that you would see on a list of like childhood vaccines that you need to get. It's mostly because it's not eradicated completely, but it's not very prevalent in the US. So, if you were to travel outside of the US and go to a developing country, that has typhoid, you would most likely want to get the prevention vaccine, the preventative measure, and it is called Typhum. It's an IM injection, and you usually get it 2 weeks before you travel. That way, those antibodies can build up, and you can get it as young as 2 years old. And I think that data was a little old because I looked it up later, and it said that you could get it as young as 6 months. So I'm not sure about that, but also like if you are going to a developing country, also practice safe food handling. Try and keep that down that way because that typhoid vaccine, I mean, it's only as good as the prevention of safe food handling. So just keep that in mind. So they found that genetic genetic profiles of the typhoid patients, specifically in Vietnam and Nepal, those are both developing countries, but they have found that there has been like a genetic variant mapping near the human leukocyte antigen, um, that showed very strong association with the resistance of typhoid fever. So basically, they have had that for so long, and it's been such a generational thing that their immune systems have just adapted, and it just doesn't bother them anymore. So I thought that was pretty cool. Environmental factors. So, obviously, your home country or if your area doesn't have clean water and poor sanitation, if you eat undercooked meat, poor hygiene, crowding, and also the areas that have monsoons, an increase in temperature, rainfall, and river levels have been linked to higher typhoid diagnoses. So, that makes sense because, I mean, if you have a field and everybody's just going in this field and using the bathroom and then it rains and it runs down the field and goes into all your crops, I mean that right there is just poor sanitation. So with increased water, that sanitation can be spread over everywhere and cause typhoid. So risk factors, the chances of getting typhoid fever is very low in the United States. The chances increase for people in the United States who have traveled to countries in Africa, Asia, Latin America, mostly where the diseases are common. They visit the rural areas where they're not in much of a city. So, usually in cities, they have some type of sanitation. In the rural areas, they really don't because they're not regulated. If they visit family and friends in these countries and they are not vaccinated. So, if you don't get vaccinated and you're basically just kind of on your own with that. Um, so, in conclusion, the rate of typhoid has gone down tremendously due to the extensive research worldwide to find a cure and a preventable measure. So, we had figured out that, okay, this is what causes that. We need to do some type of sanitation measures and not just have chamber pots and pour them into the street. Um, so, we've grown a lot to find that, and with increased sanitation and modern medicine, typhoid it could be eradicated. So if we could go to these developing countries and be like, listen, it's not okay to walk in somebody's excrement. um, Honestly, it could be eradicated. So if countries with high cases of typhoid would allocate funds to provide clean water and contaminated food, then cases of tetanus, no, cases of typhoid in these countries would go down. So I mean, that just to me that just seems obvious, but I think if instead of thinking about other things and providing. I think providing for the people is mostly the most important thing that you should be doing in a country, but some countries, they just don't have that on their minds. So if if typhoid is such prevalent in your country, you obviously need to be doing something to fix that. So in conclusion, that is typhoid fever. And these are my citations, and this is what I looked like during that entire presentation. So thank you.